but they claim that they've got an ambitious 10-year plan for the NHS. Is that a good thing?
I mean, the NHS needs to reform in terms of it needs to reinstate a publicly provided NHS. That is the line. In terms of his 10-year plan, there's no reform. It's just more of the same. The 3 shifts he talks about from treatment to prevention, from hospital to community, we've talked about already, and it should never be an either or, right? So that's the thing. Well, you know, all of those things are important. Prevention is important, but not the way they're talking about prevention. I mean, the amount of lives you're going to save with things like expanding newborn screening is minuscule compared to the amount of lives you could save with a proper, you know, multi-sector approach to improving the health of the public, poverty reduction, improving housing, you know, all of that. That is really what's needed in terms of prevention, and that would make a massive difference. They don't understand prevention, you know, so that what they understand is what can we make money off? What do companies want to do?
I think it's how could we blame people for their own ill health?
Well, absolutely. That's the other point. And I was in that prevention fringe meeting yesterday. That was the other thing. So they picked out some groups that they talked about. They picked out disabled. A BAME, which is an outdated term, and I would add obviously you know, the poorest communities to that as well. And they said, well, they're not accessing, you know, the health prevention and health promotion strategies that we're pushing, like, you know, more walking and so on. So they seem to think, well, if we just tell people to stop smoking and go for more walks, then they'll be fine.
And in
which
some
is not
cases make them take weight loss drugs, which we've seen with West Street in partnering up with the DWP
well, exactly,
to say if you're out of work and we think you're fat, then you could lose your benefits if you don't take this. Quite dangerous.
It's very, very dangerous. Very shocking for a government to be doing something like that. Yes. It is not his job to tell anyone to take any kind of medicine. If he wants to do that, he needs to go to medical school first. So I just think it's just continuing.